Hi all, today we are discussing about upper limb anatomy. The first bone in upper limb is clavicle. Clavicle is a long bone. It consists of one shaft and two ends. One is lateral and another one is medial. Medial end is also called sternal end and lateral end is also called acromial end. Because medial end articulates with the sternum, so it is called sternal end, and lateral end of the clavicle articulates with the acromion of the scapula because it is called acromial end. The clavicle has a cylindrical part called shaft. The shaft is divisible into lateral 1/3 and medial 2/3. Lateral means away from the body axis. Medial means close to the body axis. Body axis is referred as sternum, middle of the body. The lateral 1/3 of the shaft is flattened. In this part of the bone has two surfaces, superior and inferior. The superior surface is subcutaneous. Subcutaneous means which lies under the skin, and the inferior surface presents an elevation called conoid tubercle and a ridge called trapezoid ridge. Tubercle means a elevation, a rounded elevation of the part of the bone. And there is a part in medial end called costal tuberosity. On the medial part of the clavicle is broad, rough surface is the costal tuberosity, an impression for costoclavicular ligament. Now moving on to medial 2/3 of the shaft is rounded and have four surfaces: anterior, posterior, superior and inferior. Posterior surface is smooth. In medial 2/3 of shaft, there has lateral half of this surface has a longitudinal subclavian groove. The nutrient foramen lies at the lateral end of groove, which gives nourishment to the clavicle. Now moving on the articulations of lateral or acromial end, the medial or sternal end. The acromial end articulates with the acromion process of the scapula to form the acromioclavicular joint, and medial end or sternal end articulation with the first costal cartilage, and also articulates with the clavicle notch of the manubrium sterni to form the sternoclavicular joint. Now we are moving on to side determination. It is important to know what is what. From the following characters you have to determine the clavicle. In the clavicle, the lateral end is flat and medial end is large and quadrated or slightly round. The shaft is slightly curved like S. I mean S letter. Now we are moving on to the next segment. It is interesting. So specialties of clavicle. It is the only bone lies that horizontally along the body, and it is subcutaneous means lies under only down to the skin. When we palpate on the clavicle, we can feel the clavicle as a collar, so it is also called as collarbone. And also it is the only one bone which also is in the membrane, and it is also first bone starts ossification in the 5th week of intrauterine life. And moving on to sex determination of clavicle. In females, the clavicle is shorter, lighter, thinner, smoother and less curved than in males. And also in females, the lateral end of the clavicle is little below the medial end. In males, the lateral end is either at the same level or slightly higher than medial end. Now coming to the ossification of clavicle. The clavicle is the first bone in the body to ossify except its medial end. It ossifies in membrane only. It ossifies from two primary centers and one secondary center. The two primary centers appear in the shaft between the 5th and 6th weeks of intrauterine life and fuses about the 45th day. And now secondary center for the medial end appears during 15 to 17 years and fuses with the shaft during 21 to 22 years. Occasionally they may be secondary center for the acromial end. So the point is very interesting. The bone which starts ossification in 5th or 6th week of intrauterine life and ends the full ossification or completion of ossification at the year 21 or 22. It's how interesting. Okay, the position of the clavicle in the skeleton is shown in the above picture. It is the superficial anatomy of clavicle, and deep is very deep. There are muscle notches, muscle insertions, muscle pathways, muscle origins. So that it's for today, guys. See you on next informative video. Bye.